The UK has some of the highest asthma rates in Europe, with nearly 5.4 million Brits suffering from it. 1.1 million children and 1 in 12 adults, that's 43 million, currently receive treatment for asthma. Asthma attacks hospitalise someone every 8 minutes, and on average 185 people in a day are admitted to hospital because of asthma attacks in the UK. 3 people even die from asthma every day. Dr. Dominic Shaw at the University of Nottingham and Kai Gate, co-founder of a new app at GSK, hope it'll help asthma sufferers check and track their asthma and monitor any potential asthma triggers. First of all, Dominic, just how widespread is asthma in the UK?
Asthma is a very important and prevalent condition. That means it affects a lot of people within the UK. We think it probably affects around 1 in 11 people, and about 5.4 million people in the UK are thought to have asthma. Of those, just under 1 million are children and the rest are adults. We have one of the highest prevalences of asthma in the world in the UK.
Why are the asthma levels here so high?
That's a very good question, and I don't think we have a full answer yet. There are various hypotheses, i.e. theories. One is the hygiene hypothesis, where we think that people aren't exposed to the bugs and toxins in the environment because we're much cleaner living than we used to be. Another is air pollution. Another is that we're much better at diagnosing asthma in this day and age. However, the real cause is yet to be fully understood.
So where did the idea for this particular app come then? Where did it come from?
The idea for the app was something that Kai and I discussed for a while. In my case, I've been aware that there are several incidences of people having worsening asthma symptoms in a geographical location. And there's quite a famous story from Barcelona a few years ago, where a large ship would enter the dock every few weeks and unload a large shipment of soybean. And soybean contains an allergen that can upset people with asthma. And every few weeks when this ship unloaded its cargo, patients around the port got very unwell with their asthma and were admitted into hospital. And eventually some very clever detective work where they plotted where the patients were being admitted and they plotted the traffic in the port, made them realise that actually it was the ship being unloaded. And they introduced a new filter system onto the ship, and it stopped the soybean going into the air and it reduced the number of asthma exacerbations. So the idea with the phone is to also gather environmental data, pollution, temperature, humidity, weather, pollen, exercise, and see if patients themselves can individually understand where their asthma is being triggered from.
And in relation to this, then, what's the cost to the UK economy of asthma? I mean, in terms of not only the impact on the NHS, but employers and so on. Is there a way of working out what that overall cost is?
The cost of asthma in the UK is absolutely staggering. It probably costs the NHS over £1 billion a year. Not just that, there's lost work days. We have over 140 admissions per day into the NHS with asthma exacerbations, and it still kills approximately 3 patients a day in the UK. This is pretty bad, given that asthma is a potentially completely reversible and treatable condition. So we need to do as much as we can to improve patients' asthma control and prevent this disease exerting the burden that it currently does.
Also joining me on the line is Kai Gate. Now, how will MyAsthma help?
So MyAsthma has been designed to help patients understand more about their condition and what may be affecting it. It's been designed to bring in data from the patient, so what they perceive to be their asthma triggers. And once they've input that information, it layers that with information we gather from environmental data services, such as pollen, pollution, temperature. And it also integrates data from wearable devices and the Apple Health platform, for example. So it adds a richness through data coming in with the patient's input to actually help them understand how they're managing their asthma and where they're more potentially at risk. We use a test called the asthma control test to help them understand their level of control at the moment, and we retest it with them every 30 days to see how their asthma is progressing and hopefully improving as they learn more from the app.
I mean, it sounds like a great idea, but why is it being introduced now?
It's been introduced now because I think one of the biggest advances has been smartphone technology. We're able to leverage a lot around the connection to the internet, especially with smartphones, the sensors within smartphones, and the growth of things like wearable devices are allowing us to connect more data together. So it felt like the great opportunity to bring lots of resources together behind the scenes to help create an app that would really help patients understand their asthma and how it may affect their daily lives.
Now, Dominic, you mentioned a little bit earlier about needing to do as much as we can. Now, we know that the London Mayor, Sadiq Khan, has committed to this ultra-low emission zone by 2019. How far do you think moves like that will go to help reducing asthma?
I fully support moves to reduce levels of pollution in city centres. I think it's something that's very, very important. The data on the link between pollution and worsening respiratory disease are very strong. In terms of pollution exposure causing asthma, the data are not as strong. However, it has been shown that pollution can increase asthma exacerbations. So I think it's important that we discriminate between asthma, the cause of asthma itself, and episodes of asthma exacerbations, worsenings or attacks that patients undergo. And these are episodes of cough, wheeze and breathlessness that aren't relieved by normal inhalers. And these are the things, the asthma attacks, that lead to patient deaths and admissions into hospital.
Kai, where does the information that the app uses to make its assessments actually come from? Where is it resourced?
So we worked with the University of Nottingham on designing the app. The team there helped us refine what the triggers were. They helped us understand what some of the new areas of research we're looking at. And what we've done is we've partnered with external companies to get some of the most high-quality environmental data. We've built in integrations to wearable devices and some of the leading fitness applications so that this data is all brought in passively behind the scenes. And what that does is it means that the patient has a minimal input onto the app, but actually it brings a complete richness to the app in terms of layering data up without them ever knowing.
And where can people go if they want more information? How do they get the app?
So they can visit myasthma.com, where there's a link directly to the iTunes App Store, and it's free to download and publicly available now.
My thanks to Dr. Dominic Shaw and Kai Gate.